Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Today in this video lecture we are going to see the bone marrow examination. So what is bone marrow examination? So, my name is Muhammad Kamil Khan and you guys watching Kami Microbiologist channel. So let's start the video. So in this video we are going to see the bone marrow aspiration and bone marrow biopsy. So remember, bone marrow examination means the examination of the bone marrow, and aspiration and bone marrow biopsy. So in this video lecture we are going to cover the bone marrow aspiration. Remember, bone marrow aspiration and bone marrow biopsy both are the similar, but a little bit the difference is that in bone marrow aspiration we mostly take the liquid portion or the viscous portion, or we can say bone marrow we can take and in the bone marrow biopsy we take the tissue or the solid part of the bone marrow. Okay, so this is a little bit difference, and the rest of the technique are almost similar. Now let's see that what we are going to study in this video lecture. So in this video lecture we are going to see the introduction of the bone marrow aspiration, that what is actually bone marrow aspiration, bone marrow, each and everything. Then after that we will see that what is actually the purpose of the bone marrow aspiration, means that why we perform the bone marrow aspiration. Then we are going to see the requirements of the bone marrow aspiration, that when we are going to perform the bone marrow aspiration what we need to require. After that we will see the site for bone marrow aspiration, which is the specific area through which we can perform the bone marrow aspiration. Then we are going to see the procedure of this technique. After that we will see the staining procedure, and then we will see the examination of the bone marrow under the microscope. Let's start the topic with the introduction. First of all, what is bone? As all of you better know, that bone is a hard connective, or we can say dense connective tissue, and it is important to make the body the main framework of the body, or we can say structural framework, or we can say the network, or we can also say the skeletal. It can make the skeletal of the body. Okay, and due to this way it will provide the protection, support and mobility to the body. Then we have the composition of the bone marrow, the composition of the bone. So bone is actually composed of collagen fibers, mineral, calcium, phosphorus, and due to the presence of this material it can provide the characteristic strength, rigidity to the bone. Now I'm not going to explain this, but this is the bone. Okay, there are different types of the bone, as you can see: flat, long, smooth, short. These are the bone, and when it is connected together then we get the skeleton. So normally in normal adult there is 206 bones, and we have also the cartilage and ligament as well. So this is about a little bit about the bone. Now let's see that what is bone marrow. So bone marrow is actually the soft spongy tissue that is available inside the bone cavity, we can say, and it is mostly available into the hip bone, breastbone, ribs and vertebra. At that specific area you will see the bone marrow. And what are the function of this bone marrow? So it can produce different blood cells like white blood cell, red blood cell, platelets, etc. And it is also important into the immune system as well. Now as we understand about the bone as well as the bone marrow, let's talk about the bone marrow aspiration. So it is actually the technique, or it is actually the procedure, medical procedure, in which we can obtain the bone marrow sample, or we can say bone marrow liquid or bone marrow specimen, and we use it for the different diagnostic purpose. How we can get the bone marrow? So in this case, as you can see this in these two pictures, first of all the patient should be placed at this position or at this position, as you can see. Then we will take the insert the needle, which we will explain later, that we will use saline needle or Kelmi needle. We will insert it and then we will take the bone marrow. Okay, and we will insert it mostly at the hip portion, and then we will take the liquid. Moreover, this liquid portion of the bone marrow should be examined. We will make the smear and on the slide, and then we will examine it under the microscope, and we'll see the number, size, maturity of all the blood cells, as well as we will also check the abnormality of the blood cells like leukemia, lymphoma, or other blood disorder as well. Now let's see that why we perform this bone marrow aspiration. The bone marrow aspiration is performed for different purposes. The first main important purpose of the bone marrow is that the doctor recommend this to check different blood disorder like leukemia, which is the blood cancer, anemia, in which the RBC or hemoglobin level are low, lymphoma, this is also the cancer, metastatic cancer, multiple myeloma. So all these are actually the blood disorder, so it is recommended to check the blood disorder. Next is that it is also recommended to see the bone marrow function, as we better know that the bone marrow function is the production of the blood cells. So if there is low blood cells production or high blood cell production, it means that the bone marrow are not functioning well. So we will see the bone marrow function through this bone marrow aspiration. The bone marrow aspiration is also done to check the parasitic infection inside the bone marrow. And due to the parasitic infection, there will be also some disturbance into the blood cell as well. It is also important to see the treatment which we are providing for the cancer patient, like chemotherapy, radiotherapy. Okay, and it is also important to provide the suitable treatment for the patient, like chemotherapy is important, radiotherapy, or bone marrow transplantation. So through this technique we will guide the patient, or we will easily guide ourselves that what type of the treatment is necessary for the patient. Now through this bone marrow aspiration we can perform a research, and through this research we can examine the different aspects of the hematopoiesis, and through this way we can easily develop not easily, but we can develop the treatment and for the blood disorder. Through this bone marrow aspiration we can evaluate the pancytopenia, and pancytopenia means low level of the blood cells like RBC, WBC, and platelets. Through this bone marrow aspiration, this bone marrow aspiration is also recommended when the blood test report is abnormal. Normally it is not recommended, but let's suppose if the blood test we are going to do and we are going to see that there is abnormal into the blood cells, so then we recommend the bone marrow aspiration. And this test is also used to check the vitamin B12 and folic acid deficiency, as well as the HB deficiency as well. This test is also used to check the bleeding as well as the clotting problem as well. Now let's see that what we required while performing that test. The first, we required personal protective equipment, which is really important. In personal protective equipment we use goggles, we use gloves, we use overall, we use cap, we use mask. So all these things we mostly use. We use local anesthesia, so it is important to numb the specific area from where we take the bone marrow, means the hip portion as well. Syringe bandage gauze. Syringe bandage gauze is also important because through syringe we can take the bone marrow sample. Through bandage we will cover the specific area from where we take the bone marrow, and gauze is also important to clean the specific area using the antiseptic liquid. We need a microscope through which we will examine the slides on which we prepared the smear. Slides is also important because through the slide we can easily prepare the smear for the examination of the bone marrow cells. Antiseptic fluid or liquid is important to sterilize the specific area from where we take the bone marrow sample. Bone marrow aspiration needle, we can say like Jamshedi needle, Saleh and Kelme needle. In this case the Jamshedi needle is specially used for the bone marrow biopsy, but these two, Saleh and Kelme needle, are mostly important for the bone marrow aspiration. These are the Kelme and Saleh needle. There is a little bit difference, as you can see at that specific portion you will see the difference. Okay, in the Saleh portion you will see this adjusted gauge and needle, but in this Kelme portion there will be no. Now this is the Saleh needle and this is the stylet portion of the needle. Let's see the location or the site from where we can perform the bone marrow aspiration. We can perform it through sternum, but sternum is not mostly recommended. Why? Because near the sternum there is the heart available, so that's why it is mostly not recommended. The most common site for the bone marrow aspiration is the posterior superior iliac crest, or we can say anterior superior iliac crest. This is most important area. We can say the hip bone as well. Now another common portion is the tibia portion, okay, in which this tibia portion means if we want to take the bone marrow sample, so this tibia portion mostly recommended in case of the child, when the child is below 1 year, so then we will take the bone marrow from this tibia portion. Let's see the procedure of the bone marrow aspiration. First of all, the patient should be prepared at a specific position. Let me show the position of the patient. So this is the position of the patient. It should be at that position. This is the specific position of the patient, okay. Through this position we can easily take the bone marrow easily. Next is the site area selection. So we mostly select the hip bone, pelvic bone, we can say. So this is most important, like posterior anterior iliac crest area. And once it is selected, so then it should be marked. After that, that specific area should be sterilized with antiseptic solution or using cotton. Then that area will be we will use local anesthesia at that specific area, so the specific area will be numb, means no pain, sedation will be felt. After this, we will insert the needle, like Saleh needle or Kelmi needle. We will insert it okay. Now once we will insert it into the bone marrow cavity, so then what we will do, we will remove, let me show, we will remove this stylet area. Now it is inserted, so then we will remove the stylet area, and through this area we will insert the injection syringe, and through this syringe we will pull the pistil portion and it will withdraw the blood, okay. So once the blood is withdrawn, means we can say the bone marrow is withdrawn, the fluid of the bone marrow is withdrawn, so then we will remove the needle and will apply the bandage. We will cover the specific area with the bandage, and after that what we will do, we will make the smear. We will put small drops of the bone marrow onto the slide and will make the smear, as you can see. So we will take almost 10 slides and will prepare 10 slides. After that we will fix these slides using methanol and will stain it with the Romanowski stain, like Leishman and Gemza stain. After that we will use the parallel stain to see the iron storage into the bone marrow. Once the staining and the fixation process is done, so then it is ready for the microscopic examination. So this is the procedure. Let's see that what we will examine under the microscope through the bone marrow aspiration. So in bone marrow aspiration we will see the cellularity, megakaryopoiesis, we will see the erythropoiesis, parasites, myelogram, ME ratio, iron storage, etc. So these are the most important thing that we will mostly examine into the bone marrow aspiration. First of all, cellularity. So cellularity means the normal size shape of the cells into the bone marrow. So in this case, remember that if we see the normocellular, so normocellular contain 40% fat cell and 60% marrow cells. Hypercellular means that it should contain, if let's suppose there is a hypercellular, so there will be a low number of the fat cell, and if there is a hypocellular condition, so it means that there will be a high number of the fat cells. Now under the microscope, this is not the real picture, but under the microscope you will see the picture like that. This is a normal cellular. If you see the cells in per field like this, so this means that this is the normal cellular. Now if you see per field the cell condition like that, it means that this is the hypocellular. What does it mean? It means that in this case the fat cells are increased. Now these white are the fat cells and these are the, as you can see, these the cells having the nucleus, these are the marrow cells. Next we have hypercellular. So in this case there will be low number of the fat cells. So as you can see, the fat cells are very low number, and these are the marrow cells that are in the high number. So this is about the cellularity. We will check the cellularity of the bone marrow. After that we will check the megakaryopoiesis. So megakaryopoiesis means the stage through which we can get the karyocytes, megakaryocytes, or it is actually the bone cells as well, and it is important to give rise platelets and other cell as well. So per field we will see 3 to 6 megakaryocyte. It should be counted per cells. Now this is the mature megakaryocyte, so we should count it. If let's suppose we see these three conditions, so there will be also the abnormality into the bone marrow, we can say like that. If we count 3 to 6 megakaryocyte per field, so it means that the bone marrow is okay, or we can say the bone is okay, there is no problem. Erythropoiesis means the formation of the RBC, in which we will see the quality and quantity of the RBC. If there is a low level of the RBC, so it means that we have anemia. Okay, so in this case these are the cell stages. As you can see, if you see any one of the stage, it means that there is a serious condition into the bone marrow. If you see the erythrocytes, so it means that the bone marrow is okay. Myelopoiesis, it means that the formation of the myelocyte which will give rise to WBC. So this is the first stage, myeloblast, proelloblast. I already explained the blood cells formation. Hematopoiesis I already explained in detail. It is present into my channel, you can go back. Here I'm not going to explain it again because the video will be lengthy then. Okay, so in myelopoiesis we will see, or we will check the myelocytes. So myelocytes will give rise to WBC, like neutrophils or eosinophil or basophils. So in this case we will see the myelocytes. Now if you see in the field of the microscope, if you see this types of the picture, so it means that this is the abnormal myelocytes. And if you see, as you can see, these are the neutrophil, eosinophil available, each and everything, and it's a normal shape, and number is also in a normal, so it means that this is the normal. Then it means that the bone marrow is okay. In this case we will also check the leukemia condition as well. Now this is the types of the leukemia. There are also some other types as well. AML means acute myeloid leukemia. So this is the AML. If you see in the field like this condition, so you will say that it is the acute myeloid leukemia. This is the acute lymphoid leukemia. So if you see into the microscopic field, if you see the cells like in this condition, so it means that this is the acute leukemia condition. This is the chronic myeloid leukemia. As you can see, there's a lot of the white blood cells, and it's a very large in number, and you can see that this is the chronic, and this is the chronic lymphoid leukemia. Okay, so if you see into the field like this condition, it means that there is a leukemia. Parasites. So in parasitic, in the bone marrow aspiration, we will also examine the parasites. So this is the parasite like Plasmodium vivax, Plasmodium falciparum. Sorry, these are Plasmodium falciparum. So we will also check the Plasmodium falciparum and Leishmania duodenum. This is the Leishmania. Okay. Then we will also check the myelogram. Myelogram means nucleated cells. Okay, all WBC that contain the nucleus, we will call that myelogram. So at least in differential cell count, we will count 100 cells at least, and in the myelogram we will check we will count almost 500 nucleated cells in myelogram. And if it is 500, it means the bone marrow is okay, there is no problem. And ME ratio is also important, and if you count total number of myeloid cell, total number of erythrocytes, so then it will be divided, then you will get the myeloid erythroid ratio. So the normal ratio is 1 to 2 to 5 to 1 ratio. This is the normal ratio. Now then we have this is the normal ME ratio. If you see under the microscope, so myeloid ratio will be like in this way, and this is the abnormal, or we can say increased ME ratio. Okay, it is also, we can say, a type of cancer. Iron storage. So in iron storage, in the bone marrow aspiration, we will check the iron deficiency anemia and sideroblastic anemia. In sideroblastic anemia, inside the cells you will see sideroblastic anemia you will see these particles, small particles, granules into the red blood cell. And into the iron deficiency, this is the iron deficiency anemia, which we can say this is the hypochromia condition. Okay, so this is all about the bone marrow aspiration, and I hope this video is helpful for you. If you like this video, so make sure to hit the like button, share this video, and also subscribe my channel to get more interesting videos like that. Thank you so much for watching.